Good afternoon, and thank you for joining us for navigating the healthcare journey or a caregiver journey. We are so happy that each of you could join us for what we are sure to be an informative session. I am Tiara Green, Interim CEO with Accessia Health, and excited to be your moderator for today. Before we get started, just want to cover a few housekeeping items. First, all lines are muted throughout the duration of the webinar. However, you are welcome to submit any questions that you may have through the Q&A section on your screen. We will have time at the end of the presentation to answer any questions that you may have. For the convenience of some viewers and those who are hearing impaired, closed captioning has been turned on, and this webinar is being recorded and will be available on our website at accessiahealth.org. We are so excited to have our speakers with us today. And before we get started and hear more from them, just a disclaimer, and that the thoughts and comments that are made are intended to provide information to the public. The views and opinions expressed by any speakers or third parties are not necessarily those of Accessia Health. Without further ado, I'm excited to introduce our speakers for today. First is Susan. Susan leads partnership outreach at CaringBridge, a nonprofit that partners with hundreds of organizations who share CaringBridge with their patients, members, and employees. And she brings years of experience to CaringBridge as a marketing executive in branding, direct response, and social marketing, as well as new business development. Welcome, Susan. We're happy to have you.
Thank you. Thank you so much. I really appreciate the opportunity to be here today, especially during National Family Caregiver Month, an important month to really honor and elevate the incredible work that family caregivers do every day. I'm also excited to share CaringBridge today with everyone, as it's a great resource to use to surround a family caregiver with support, share a loved one's health journey, and organize and activate a support network. Thank you.
Thank you. And next up is Molly. Molly brings passion and real-life experience to her role with the National Genetics Education and Family Support Center, where she serves as a senior program manager. Molly has extensive experience working with diverse groups from local to international in providing family leadership training. She has dedicated her life's work to improving the experiences and outcomes of all families with children with special healthcare needs. Molly is committed to actively engaging families as equal partners in their child's healthcare and ensuring that the family's voice is represented throughout the family's journey and within their system of care. She believes that this change happens at the system level when there is diverse representation and honest dialogue amongst all parties. Welcome, Molly.
Yeah, thank you. I too am very, very excited to be here today to talk about caregivers, to talk about not only the struggles, but also as we think about it, the joys. And I don't think it's one thing or another. So again, I love conversations about this as we can kind of learn about that human experience as we move through these different phases in our lives. And I hope that those participating will put some questions in the Q&A and we can get some interaction as well from that.
Yes, I look forward to that conversation. As Susan mentioned, it is National Family Caregiver Month, and we are so happy that both of you could join us today, and thank you for your time and expertise. Each year during Family Caregiver Month, there's a different theme to recognize the hard work that caregivers put in each and every day. And it was ironic that this year's theme is Caregivers Connect. So in alignment with that theme, we're happy to host this webinar to not only connect with caregivers, but also support them and urge them to connect with each other and others who are on that caregiver journey. So we look at the typical caregiver and the number of caregivers that are in the U.S. More than 50 million Americans provide care to a loved one. and 58% are women. 1/3 of caregivers provide at least 20 hours of care per week. So for someone managing their health care and the health care of a loved one while working, it could be a strain on them in many different ways. When we look at the future, 1 in 6 individuals expect to become caregivers within the next 2 years. So we have some preparation to do to assist those individuals in caring for their loved ones and to make sure at the same time that they're caring for themselves. Approximately 1 in 5 caregivers report fair or poor health. And there was a study by the National Alliance for Caregiving and AARP that indicated that 1 in 4 American caregivers report that their health care became worse once they were a caregiver. So if we look at the numbers, this was an incredible map that CDC put out. If we look at caregivers 45 years of age and older who report having 2 or more chronic conditions while caring with someone else, the numbers are staggering. So it is important for us to have this conversation today so that we can equip individuals to care for themselves and their loved ones, and sometimes making sure that we're putting that oxygen mask on ourselves when caring for loved ones. So I'd like to start our conversation with just what we would think would be a simple definition or a quick answer, but Molly, I'll go to you first. In your own words, how would you describe the role of the caregiver?
Well, I think, when I thought about this question, I think it's complex because I think sometimes when we say caregivers, sometimes people immediately think of one thing or another. So I even want to go back to like, who is a caregiver or besides just that role? And so that person can be an individual. It can be a family member that's taking care of a child with a special health care need. It can be someone who's taking care of their parent who's aging. It can be a spouse or a partner who's taking care of someone who has a chronic health condition. And so again, I think as we think about that, all of those roles, they could look very different. So what is that role for caregiving? Again, so if you have a small child, that role might be you're responsible for a lot of their care. And so there's that continuum that it sort of falls on. But when I think of that role of caregiver and what that's meant to me and our family, I really think about it as this idea of really ensuring someone whom I love is receiving what they need to live their best life and what it looks like that in that moment with that condition and stuff like that.
Absolutely. Susan, could you describe the role of a caregiver in your words?
Absolutely. I was a family caregiver for my mother. She lived to be 95, and I started taking care of her for about 25 years, so a very long time. And in the last 5 years of her life, that role really intensified. And I just look back at it and I remember being a bit overwhelmed, stressed, lonely at times, feeling kind of isolated. My siblings all live out of town and far away in Texas and Boise, Idaho. And so really no one was nearby that could really help. I just remember, you kind of, you become a superwoman or Superman. You take it all on, from transportation to doctor appointments, to taking a parent to church, to feeding, to clothing, to bathing, as time goes on. It really is, it can be a very big job, but if you have a network that you can reach out to for help, that's the best advice I can give.
I like that because you said it's a very big job. And I think that some people forget that it feels like a job. Yes, you absolutely love your family members, but it is a task, a loving task, but sometimes the role is also paid, right? So there are some caregivers who are family members and they are expressing their love in that way by caring for them. And there are some caregivers that are in a paid role, and maybe it's a home health aide, or something of that nature. But inevitably, they are caring for someone who needs them. So when we think about, and I was showing those numbers, talking about the impact on one's health when caring for someone else, what are some of the strains that caregivers may experience when they're caring for those loved ones? We'll start with Molly.
Yeah, I was gonna say, I'll jump right in because it reminds me of what Susan said. I think one of it, when you talk about the health, I mean, it impacts your life in so many ways. So it can impact it just from, again, you're not getting enough sleep, you're not getting enough eat. So it's sort of your basic kind of human needs, but then also um, that mental health aspect of the weight of caring for somebody. And sometimes those decisions aren't always clear cut when you're making decisions as a caregiver. And so you're trying to do the best that you can, but you feel the weight of that. And so again, it can be just a tremendous toll on your mental health as well as on your physical health. And we won't even forget or talk about financial and all of the other kinds of things, but it really does impact every aspect of your life. And again, it does depend on what level of caregiving you're at. So it doesn't always have to be that most extreme, but even if it doesn't feel like it is that, one 24/7 kind of thing, there is that impact that still is there, that that added stress.
Absolutely. Susan?
Yeah, for me, with my mom, like the first 20 years were really companionship, taking her grocery shopping and taking her to lunch and taking her shopping and just doing things with her that she loved to do. And then the last 5 years, as I mentioned earlier, started to really intensify for me. And the last 4 months of her life, she was on hospice, and I was one of her primary caregivers. But obviously, at that point with hospice, had nurses and aides and other people coming in. But still to this day, and I've talked to other people that have been family caregivers and have taken care of a parent who was on hospice. I have a sense of guilt and uncertainty. Did I do the right thing? You don't know. I'm not a healthcare professional. They weren't always there. I tried to live by my mother's wishes. And I felt that if she didn't want to take a medication, I wasn't going to give it to her because she asked specifically not to have it. And since she was in the process of dying anyways, it didn't seem like I needed to mandate that she take the medication, right? I wanted her to die the way that she wanted to die.
And
you
I just
were-
want to, yeah, I was
Go
going to
ahead.
say, so that's right. So that's one spectrum. So again, so my journey is parenting two children that had special healthcare needs. So I think it gets a little bit even murkier sometimes when you knew your mom, you sort of tried to go by her wishes, whereas sometimes you're doing things and making choices for little people that you're not quite sure what they would have chosen at that point.
Right.
And some of these can be very life-altering type decisions. And so it really is, I think you're right, that guilt and that trying to figure out what you think is best, but not just best for you, but best for them and what potentially they and how they would like. So
Those are really great points. And when caring for someone older, that's the time when we think about having our personal affairs outlined and having a living will, or understanding and having those difficult conversations before it gets to that point with our loved ones to say, should something ever happen to me, this is what I would like. It makes it a little bit easier, even though we're still going to feel a little bit of guilt. It makes it a little bit easier, and then you're carrying out the plan that they want. And in the case that you were describing, Molly, with caring for little ones, your mom, your caregiver, you're helping with the daily task and working and doing housework. So it's a balancing act. We said we weren't even going to talk about the financial strain that it causes, but it can cause a financial strain. AARP did a survey in 2021, and they found that family caregivers provide about $600 billion in unpaid care each year
Mhm.
and spend about 1/4 of their income on caregiving activities. This may include medical costs, household expenses, or even household modifications if you're thinking someone who's now in a wheelchair and you need to make the home wheelchair accessible. Can you share some tips for navigating the financial and legal landscape in relation to healthcare?
Yeah, and that's a super complex question and a super complex answer. So again, as we talked about that, I think part of it is so I'm going to start it out with this preface that there are a lot of systems out there. There are a lot of programs out there that are to sort of assist with this. So if you're talking about children and sort of that special healthcare needs population, each of the states and quite a few of the territories have family to family health information centers. So those are great places for families with children and youth with special health care needs to sort of reach out and talk to them about that. Because again, as we each have different types of insurance and
Mhm.
it doesn't, you talk about Medicare or Medicaid across states and it looks different with each state. And it's very complex that. So I'm trying to give some like big sort of picture things. Or again, if you're taking care of a loved one who's older, I would definitely reach out to the aging and disability resource centers that are in your community and stuff like that. And again, to me, that sort of navigating that piece of it, which is almost a full-time job on itself, whether you're trying to
Mhm.
navigate insurance coverage, whether you're trying to navigate respite care, is it's really trying to keep talking to people until you can get to that sort of right answer, because not everybody is an expert in every system. And that's what makes it
Mhm.
so hard, is not to go like, oh, just go here and you can find out. But it's really sort of that you start at one, you ask a question. If they can't give you the answer, ask them who maybe can. Like,
Right.
is there a program that maybe deals with this, or this is the problem I'm trying to solve? And really, as you're trying to think about that, think about, again, be succinct about what's the problem you're trying to solve. Again, are you trying to get insurance coverage for something and you're talking to your insurance company and they don't want, and you have private insurance and they don't want to pay? Well, there's steps you might be able to take. You might be able to get your own case manager, all the way up to your state has a commissioner on insurance that you can. So again, there's steps depending on what you're trying to navigate. But I would say the biggest thing is really try to keep talking to people. If you don't get your answer, unfortunately, I wish I could say it was easy, but you just move on to the next and keep asking. And again, that's where that toll of caregiving really starts to add up. It's because you have to keep going out there and trying to find that information.
Right. And it may take several phone calls and
Absolutely. Emails, and you talk to somebody else.
emails.
Yes.
Yes, yes. And I always tell patients to reach out to their physician. Is the
Mhm.
physician's office aware of any opportunities that you may apply for? And insurance is the other one that I often mention because we have options when it comes to our insurance. We can look at what's out there to see what's available. Is it that I really need a home health care aide that's going to come into my home? Is the insurance company going to cover this type of service if I need it, right? We're in a really good time now. It's open enrollment. Medicare open enrollment is through December 7th. So it's a great opportunity for individuals to look at their healthcare plans to see what the options are and see if there's an opportunity for some coverage. At the same time, Marketplace open enrollment began November 1st, and this is an opportunity to look at plans for those who are in the private sector or individual health care and see if there are plans that may cover. So there are also organizations like Accessia Health and other patient assistance organizations who may provide some financial assistance for out-of-pocket costs for certain conditions. So we will have a list of some resources that we've all gathered here and we'll share at the end. But it is an ongoing journey. It's an ongoing journey. Susan, did you have anything else?
Not from a financial standpoint, but I know one of the questions is resources that can be shared, so I can certainly speak to that.
Absolutely. We've all heard that phrase, and I mentioned the phrase, putting that oxygen mask on yourself before you can care for others. But we know it's easy to say, right? But also easy to lose sight of in the midst of caring for someone. So what are some resources or things that caregivers can do to take care of themselves while caring for others? And this one is what I meant to say for you, Susan. How would
Oh, that's
you
okay.
provide some resources for those individuals who need to take care of themselves?
Well, I have to make a plug for CaringBridge here because that's what CaringBridge does. So
Yes.
if people are not familiar with CaringBridge, we're a no-cost nonprofit health communications platform that surrounds family caregivers with support while they care for a loved one on a health journey. We have tools to share and document a health journey, simplify care coordination, and connect caregivers with a supportive community. CaringBridge eliminates all the chaos from a communication standpoint coming into the home. Neighbors knocking on the door, text messages, emails, phone calls. It allows the family caregiver to communicate out to everyone at the same time and share health news with everyone at once. So everyone's getting the same information and they can respond, comment on a CaringBridge page and let the family caregiver know that they're thinking about them. So they can provide emotional support. They can also provide instrumental support. We have partnerships with GoFundMe. So when you're talking about, a finance situation, you can raise money for medical expenses or just money for the family if they're financially strained through CaringBridge. We also have a partnership with Meal Train. So you can have homemade meals coming into the home and you can decide what food you like, what food you don't like, where you want people to put the food. And one of the reasons why we ended up with Meal Train is we heard from our family caregivers that they were getting like 12 pans of lasagna in a month. And one can only eat so much lasagna. We also have privacy controls. So if you only want to share your CaringBridge page with a few people, you can do that. You can also share it with all registered users on CaringBridge, or you can make it searchable in browsers, and you can toggle back and forth between those settings. So in essence, it really just gives the caregiver the control that they need, and they can reach out to their network and ask for help. And if they're not comfortable doing that, then they can have a co-author on CaringBridge, a helper who can do that hard work for them and ask their families and friends to walk the dog, do daily tasks, to bring food in, to give their loved one a ride to the doctor's appointment or whatever it might be.
I was telling Susan that I first learned about CaringBridge through a 3-year-old story with cancer, and it was good to keep up with that family story and read the mom's updates on the CaringBridge page. And in speaking with that parent, I remember her saying it was an outlet for her. It was a way for her to pour out her heart and just express how she felt without any judgment. So it became her personal journal, so to speak. Molly, how would you provide resources or some resources or things that caregivers can do to take care of themselves?
Yeah, when I was thinking about this, I think about I always feel like when I was caregiving for the kids when they were small and trying to navigate all of those things, and I always, it would be, or you click on the links and it's like, oh, self-care tips, and it's take a bubble bath or go get a massage. And I was always like, that's not really what I needed, to be honest. Sometimes, and I think this is part of, like, I shouldn't say always. Sometimes I did need a massage, or sometimes I did need 10 minutes alone in the bath. But sometimes, honestly, for me, sort of that self-care looked like grocery shopping for the week, so that I didn't have to constantly stop on my way or like look in the cabinets. And it was like, I carved out that time to go, okay, this is what I need right now. So some of it's really identifying what you need in that moment. And again, sometimes it does look like a massage or bubble bath, but sometimes it really looks like just taking care of some basic needs, or going outside and going, okay, I'm really going to just stop and look and see what the weather's doing, because I don't even remember the last time I was outside and even notice that, oh, the sun is shining, or, oh, look at my flowers are starting to pop up, or whatever.
Mm.
And then look past the weeds and think, you know what, it's okay. Right. So to me, some of that is that. And then also, I know, for myself, I'll speak for myself on this. I can fall into this. I need to take care of everything myself. I don't like to ask for help. I just have difficulties with this. And again, I know a lot of people do. But I started to reframe that, and I started to think about, like, how would I feel if my best friend was feeling the way that I felt right now,
Mhm.
and knew that I could help her, but she wasn't asking me for. So then I started to think about that as sort of like ways that people could help me. And sort of it would be like, oh, you want to drop off a meal? And again, I didn't want anybody coming in. My house is messy. I recognizing that was a me thing, but going, hey, can you just drop that off at the front door and let me know it's coming? And and again, to me, that's sort of that self-care. It's that realizing I don't have to do everything.
Mhm.
Asking for help is not really weakness, it's actually a strength. And to be able to say, I do need some help, is part of that, to, again, make sure you have enough to do what you need to do at home or in that moment of caregiving. So.
And I think those self-care tips are always going to be personalized, right? You mentioned
Yeah.
seeing, like, take a bubble bath, and that may not be the best fit for you. Maybe there's something else that is going to help you take care of yourself. We do have a question, and I'll ask this question now because it's perfect for where we are. And this is a question for you, Susan. Does CaringBridge have resources for therapy or counseling for caregivers who are feeling overwhelmed?
I did put some resources in the list that we're providing at the end. CaringBridge does partner with other organizations to share resources to our family caregivers through engagement emails that we send out, and also in our advice and inspiration section on CaringBridge, which has helpful information and articles. And as CaringBridge moves to a new platform, we are doing so in first quarter 2024. After that, the goal is to add more partners, we call them product partners, like GoFundMe and Meal Train. And we're currently doing research with our family caregivers and others to understand what resources do they really want to see on CaringBridge. Right now, there's just a plethora of resources that are available to family caregivers, but they don't necessarily have the time to sit in front of a computer and kind of sort through everything that's out there. So we want to be able to do that for them, and to be able to dial up resources that are going to fit their specific needs.
Thank you. And Molly, you may have some resources that you may want to mention from the National Genetics Education and Family Support Center.
Yeah, so a lot of the work that we do, and that's a mouthful to say, the National Genetics Education and Family Support
Yes.
Center. So we just call it the Family Center. But here at the Family Center, we have a lot of resources again. So we really support those families with children that are on a genetics journey, whether they have a diagnosis or they're trying to navigate that sort of that space of trying to find out. They know they have something going on and they're really trying to pin that down through genetics. So we do have some resources. We share a lot of like family stories. So again, so that families can start to see themselves potentially, or see how other families navigate those sort of systems and that journey. I always say that was one of the things for myself was, I saw how my parents parented me. I saw how my cousins were parented, but when I actually had my own children and they were a little bit different, I needed other family stories that looked sort of like mine to start to think about, oh, I like the way they do that. And so we try to build those connections and those networks that way so that families can really sort of see themselves. We've done a podcast and had again, we really try to do things through that connection and that journey and see, again, so people can start to think about themselves and how they want to move forward with things.
That goes hand in hand with the theme, which is why I loved the theme for this month of Caregivers Connect. It's connecting with those who may be on that same journey. I feel like we may have covered some of this next question a little bit, but anything you have to add would be appreciated. Caregiving can be emotionally and mentally draining, and demanding, I should say. What strategies or coping mechanisms can caregivers employ to manage stress and maintain their mental health? And some of that is what we just talked about with connecting with others. It may also be going to seek counseling and therapy, or even employing a home health care aide that's outside of the family, but any other resources that you can provide or strategies.
Even just connecting with a friend or a family member who can come into the home a couple times a week. So like Molly could go grocery shopping. She brought up grocery shopping, or ask them to go grocery shopping for you. Just having someone who can kind of be by your side. Doesn't have to be a lot of people. It can be a lot of people, but it doesn't have to be. Not everyone's comfortable having, a large network helping, but my goodness, it does certainly help to have just a handful of friends who are willing to walk the dog, clean the house, take someone to a doctor's appointment, whatever it might be, just to allow the family caregiver to breathe a little bit.
That mental break, right?
Right.
And I'm all about connections. All of my comments I feel like are about that, but it really is finding those that you can connect with. I think we talked about CaringBridge when it started, 26 years ago, and email and all of that really even wasn't a thing, but things have changed so much. There's so many groups online. I feel like sometimes there's that negativity associated with, online social media, but honestly, for some of the groups, there's so much connection, and there's people I've met virtually that I don't know in person, and they've offered so much support to our family or ideas. Again, it goes back to those financial or what other systems, what other programs. We all have little pieces of this. And so I think sometimes when you can put that out there and sort of connect with that group, even if you don't feel like it's here locally or someone, there are groups out there in that sort of wide world that you can connect with. And that helps in all of this.
And I'd just like to add to that, because she's absolutely right. Ever since COVID, a lot of therapy, a lot of networking groups, communities have come to life online, and a lot of them are free. So there's lots of resources out there that family caregivers can utilize where they don't necessarily have to pay, which is wonderful.
I think one of the key things here is that we have to remember that we're not alone. And every one of us at some point has been a caregiver or will be a caregiver. So asking for help when needed is very important. What advice would you give to someone who is just starting their caregiving journey? They're brand new, they just started caring for someone. What would you say? Let's go with Molly.
Yeah, I think part of it is it's scary because it's unknown, right? Like, and so if you haven't been through it, or maybe you saw somebody else in theirs and wondered how you would do it. But part of it, I think I want to add is that it's not all bad, that there's these these moments, and a lot of times they're more than just moments, but there's these times that happen, these connections. You have conversations with people, you can grow closer with them. So again, while there's all of that, both things are true. It can be a beautiful thing, it can also be super stressful at the same time. So it's, and I feel like sometimes when we're faced with that unknown, we tend to go for the stress. And I would just like to remind people that there is that beauty in that caregiving and in those moments.
Susan?
Yeah. And I'd like to add to that because, I agree. It's be proud. You're the one that stepped up to the table to be the family caregiver in this situation. And not everyone is able to take on that role.
Mm-hmm.
So be proud of yourself that you're able to do that. And don't sweat the small stuff. Let it go. Stay focused on taking care of yourself, your loved one. If you in a situation where you have children and a husband, focus on them too, and then just kind of try to let everything else go. You'll get back to it someday, but that's not your priority. So that's just going to add to the stress that you already have.
Cherish the time, right?
Mm-hmm.
Cherish that time that you do have to take care of them. So we don't get lost in becoming overwhelmed, but it's important to know that you have that opportunity to be there for your loved one. And I want to look at the flip side of that, right? How can someone support a family member who is a caregiver? What is it that they can do to support that person? Susan, any thoughts on that?
Reach out to them. It's I think we almost all do this, where it's a situation where someone is sick and you don't want to reach out or bother the person. But if you've heard about it, right, obviously the word is out and they probably need help. So don't be shy about reaching out and saying, how can I help you? And maybe even come up with some suggestions. And it doesn't have to be big things. And you can tell if the person's going to be receptive to the help or not, right? So maybe start small and build up over time, and consider starting a CaringBridge page, because it's just an easy way for people to ask for help and for you to see what types of help they need and for you to accept it. And those pages where we have a helper or a co-author, they're more heavily used because it's easier for that co-author to ask for help. So please consider starting a CaringBridge page at www.caringbridge.org. Thank you.
Thank you, Susan. Molly?
Yeah, and I liked Susan's idea of not just saying, hey, what can I do for help? Because again, I think sometimes that's hard for some people, right? But others sort of that you can be like, hey, I'm running to the grocery store. Can I drop anything off on your porch? And it's almost that whether you were going to the grocery store or not, sometimes, again, it's sort of that guilt thing that we all put on ourselves, where it's easier to think, oh, they're doing that already. I'll just, I'll just add to it. It's fine. But it's sort of that, again, not offering, or, hey, can I walk your dog? You know what? I really need some exercise. So it's almost like you take the burden off of them and put it onto yourself as far as like, hey, can you do me that favor? When in reality, you're really trying to do it for them, but ease their mind at the same time. And again, it's all dependent upon individuals, how well you know them, how well how comfortable they feel in asking you for help. But there's always things to brighten people's day, right? So again, there's people I haven't known very well that I just dropped off a little plant on their doorstep as I drove by, and I didn't even knock, sent them a message after I left, so they didn't have to feel like they had to come and answer the door, but said, or even the text of, I'm thinking of you today. I just wanted you to know I'm thinking of you today.
Yes.
And it's not, it's things like that. And again, it's sort of it's that connection that we talk about. So
Yes, it could be as easy as dropping off their favorite smoothie to their doorstep. Hey, I
absolutely.
know you love this, and I left it on your step today. Something to make you smile.
Mhm.
And we have a question from our attendees. Would the page, and I'm guessing this is the CaringBridge page, ask about what the caregiver needs or what you might need to help the person you are caring for?
So could that be published on the page? Absolutely. Absolutely. That's part of what CaringBridge is. It's also a way to share health news, but it's also a way to ask for help. It's a way for that family caregiver to really activate, and coordinate their support network.
It's amazing. Thank you, Susan.
Sure. Thank you.
And we're about to open it up for a Q&A. So if you do have questions, please submit them through the Q&A box on your screen. And one last question for you, Molly and Susan, from me at least. What do you wish others knew about the role of the caregiver?
I can go first. I wish others knew, and Molly, you mentioned this word early, that the complexity of being a family caregiver, and the highs and lows to being a caregiver. I think if people knew, I think they would reach out more and offer to help.
Yeah, I think that's good, Susan. I think it is the complexity of it. I think it's that it is one of those things it's hard to even imagine. You can sort of think you might know, but until you're in that situation, it's difficult to realize the amount of things you think about, the weight of all of that, the burden of all of that, mixed in with the joy. And so again, it is that complexity of it. I think it's the realizing, like you had, Tiara, with the statistics, chances are we're all going to be caregivers at some point.
That's right.
And so it's sort of, again, seeing what that might look like. You can't really prepare yourself in some ways, but yeah, you can know that there's things out there, and you watch and what you do for people, and when you talk to them when they're caregiving, you can start to see of what helps. And you might think about that for yourself as you come into that.
Thank you. And I'm going to share really briefly just some resources that we came up with going into this session. But we hope that if you are a caregiver and you are taking care of a loved one, that you know that you're not alone. It is important to connect with individuals who are on that same journey, and it's okay to ask for help. It is absolutely okay. And it's okay to be tired sometimes, but we want to make sure that there's a balance and that individuals are doing what they can that's going to bring them peace, because it's going to be different for everyone. Molly's is going to a grocery store. Mine may be walking around the block. But these are the resources that we have provided. There's some questions coming in, so this is the time, again, where if you have some questions, please drop them into the Q&A box on your screen, and our lovely speakers will be happy to answer. We have a few that came through. How do you help a caregiver after their loved one has passed away?
I can answer this because that happened to me. And I'll tell you, I had a strong network. I had just started at CaringBridge, and I had several people at CaringBridge kind of keeping watch over me, just checking in to see if I was doing okay. But I was truly lost the year after my mother died because I had been on such a long caregiving journey with her. I mentioned 25 years. I didn't really know what to do with myself for a year. It took a while.
Yes. Does CaringBridge have virtual support groups?
We do not at this point, but it's definitely something that CaringBridge is looking at. But we have plenty of resources and partners that CaringBridge will, share on our site that have resources. So if anybody wants to reach out to me directly to find out what some of those resources are, you're more than happy to do so. Kerber@caringbridge.org. KERB like boy ER at caringbridge.org.
Thank you, Susan. And for those I mentioned needing financial support, there are organizations like Accessia Health. You can visit our website at accessiahealth.org if needing financial resources, but also there's a good number of resources about health insurance because we mentioned you may need to look at health insurance options to see if a home health aide would be covered or any type of in-home nursing services may be covered for a loved one. There are resources on our website. And of course, we are recording this session and it will be available on our website. We have another question coming in. And that was the email address for CaringBridge. Again, it is SKERBER@caringbridge.org. The next one is someone pursuing their PhD work and conducting research on caregiving experiences and looking for individuals involved in caregiving to share their insights. Can you suggest where I may find some people to speak with? And I'll give just a general resource for this one, and you may want to reach out to some of those national caregiving organizations like Caregiver Action Network, Caregiving Resource Center, and those nationwide organizations who may have some resources for you. Anything that you'd like to add, Molly or Susan, as we wrap up?
Again, I just want to add, it is a complex journey. There's lots of emotions tied to it. And the biggest thing is to find your connections, to find your groups. If it's not someone you know currently, to start go online, reach out, look for Facebook groups, look for stuff like that. There's people out there that are experiencing similar things as you and having similar feelings. And learning about that can really be that source of comfort for you. Again, trying to, when you can, take care of yourself so that you can be there in that mode of being a caregiver for someone else.
Thank you. Susan, any final words that you'd like them to take away?
I would just like them to, if they're a family caregiver or you know of a family caregiver who needs support, really ask them to start a CaringBridge page. It takes about 2 to 3 minutes to start a page. We did research with our family caregivers last year, and compared to the national average, we do know we lower stress when they're using CaringBridge. 3 times more likely to feel like someone is in their corner when they're using CaringBridge, feeling connected to family 1.6 times greater, and then not feeling manipulated or resentful because you're a caregiver doing it on your own. Because on CaringBridge, you're connected to loved ones, they feel 3 times greater. So it's a great tool for family caregivers to lower the feelings of being stressed, overwhelmed, and isolated and lonely.
Thank you. I want to thank you, Susan and Molly, for the level of expertise that you have brought to this discussion today, and vulnerability and candidness, because I think that's important when we think about their caregiver journey. We encourage you all to take the brief survey that you'll receive at the end of this webinar. The resources that I shared are available on the accessiahealth.org website, which you should see in the chat. If you could complete the survey, it helps us to ensure we're providing the most helpful information to you all. And if you're not doing so already, please be sure to follow us on social media at Accessia Health to learn more about presentations in our upcoming webinars that will be added to this series. Again, thank you. We look forward to your feedback and hope that you all have a great day.